focus on your gum tissues, and we're going to do a full periodontal charting. But I want to show you this laminate. I want you to be able to know why we're doing this. So this laminate shows healthy stages of gum tissue all the way down to advanced periodontal gum tissue. If you can see here, there's this little ruler, and this is actually what I'll be using today when I do your periodontal charting. It's marked in millimeters. It slides right at your gum tissue between there and the tooth. And if you can see here, this is talking all about health. This ruler is only going down about 2 millimeters. So you can see there's really no infection or bone loss around there. That's nice and healthy. That's where you can get down and clean at home, brush and floss. So the gum tissues are really corally pink. They're really nice and stippled. Everything looks real nice, and there's no bone loss over here. Then we go to gingivitis. A lot of people have heard about gingivitis, but they really don't know what it is. We're still not having any bone loss. Your ruler is still 1, 2s, and 3s. Everything is still okay there, but you can see the tissues are looking just a little more red. They're looking a little more inflamed from this picture. But over here, we still aren't seeing any bone loss. At this point, that infection is just in your gum tissues. When we get down to periodontal disease, that's when the infection starts to move into your bone. And you can see here, the ruler's going down just a little bit more. That tissue is actually pulling away from the tooth, so you're getting 2, 3, 4 millimeters here. The tissue is getting a lot more red, it's a lot more inflamed, you're getting more bleeding. You're probably seeing a lot of bleeding here when you're brushing and flossing at home possibly. Then over here you can see you're starting to get a little bit of bone loss. It's changing just a little bit from this picture here. Then we get to moderate periodontitis, and that is when the probe's going to go down a little more, 4, 5, and 6 millimeters even. And the tissue is pulling away again. You can see they're really red gum tissues here, and they start to even recede sometimes upwards. Then over here in the x-ray, you can see the bone loss is getting more jagged, or what we call angular, so you really can see the bone loss, especially around those 2 molars back there. Then down here in the advanced, the probe is going down even further, 6 millimeters or more, and you can see the gum tissues are very red. You can see the plaque and tartar, and they're pulling away, going up even higher for some recession. And over here, we've lost more than 50% of the bone, so you really can see the bone loss in that area. So I'm going to lean you back, and like I said, we'll put that probe, and it'll do 6 sites of your tooth, and we'll look for some bleeding areas and let you swallow. Don't be alarmed if you hear some 4s or anything like that. There are some options, so I don't want you to be worried if you do start to hear any 4s or anything. Can I answer any questions about that?
No.
Perfect. I'm going to lean you back here. So we'll lean you back, and we'll start on the upper right, 1 through 16 on the buccal, and I'm going to look for any bleeding points, let you close and swallow, and then we'll do the inside 32 to 1, look for any bleeding points, let you close and swallow, go to the lower, and 32 all the way over to 17, let you close and swallow, and then on the inside, and we'll let you look for bleeding, and then close and swallow. Then I'm going to go back and chart the gum tissue height, so we'll do positive and negatives in the same sequence. I'm going to sit you up here. Okay, so I'm going to hand you this back so we can look at it together. And this is your chart. You can see this is a mirrored image, so this is the upper right and the upper left, and then the lower left and the lower right. And you can see the little circles are where I caught any of those bleeding points, and then of course any of the numbers are 4s are in red, so that kind of draws your attention. Looking at that, and when we talked about this, where do you think you fall into here?
I would say here.
You are definitely right. You've got a lot of great areas. You've got a lot of 1s, 2s, and 3s, a lot of areas with no bleeding, so that's a great thing. But you do have a problem. You've got an infection in your gum tissues and in the bone. So the consequence of that is if we don't do anything, that is just going to continue to get worse, and the disease will progress. Those numbers that are 4s could turn into 5s and 6s. So the good thing is I have a non-surgical solution for you. You have, like we talked about, the 4 different areas, so I'm going to put you in this here. There's only 3 teeth at the most in each quad, so you fall right in this section here. And what we'll do is we'll bring you back and clean all of those deep areas up with our special machine that goes below the gum line. It's got some water in it, and will help flush all of those areas out. You are lucky you do not have to have any antibiotics at this time. Sometimes when those 4s become 5s, we have to put some antibiotics down just to help them heal a little better. But fortunately, you don't need any of that right now. We will also continue to clean the rest of the mouth, just because that bacteria is present everywhere. Even though you don't have those deeper areas, we'll clean the whole mouth. We'll do some fluoride varnish. That's going to help with any type of sensitivity that you have after the procedure. I'm going to send you home with a prescription gel called PerioScience. It's got an antioxidant in it, and it's going to help promote healing with those tissues and help with the bacteria. But the biggest thing I'm going to do is give you a Sonicare toothbrush. Do you have an electric toothbrush at home? Perfect. This is going to be the best thing that's going to help us partner together to really take care of this. I'll do my part here, but when you go home, I'm going to want you to be able to have the best tools you can to keep everything nice and clean. There's also some other tools and different instructions we'll give you that day as well.
Great.
So we look up here, there are some contributing factors that, kind of go hand in hand with periodontal disease. I know from looking that you're on some medications as far as you are on some high blood pressure medication.
Mm-hmm.
So, we'll keep a close eye with that. Everybody has stress in their life, so I know, a lot of times our stress levels can help contribute to where our gum tissues are as well. So we talked about you're on the medication for high blood pressure, so that's anything that's got any type of an inflammatory process kind of goes hand in hand with our gum tissues. So the big thing is your diabetes. So I know you have diabetes, and sometimes it's controlled, sometimes it's not. Our numbers are a little different. The nicest thing about this is we get your gum tissues cleaned up. Studies show just from doing this sometimes and getting everything nice and cleaned up, your A1C number can actually improve by 1 point.
Wow.
And that's even better than most medication can do for you. So that's a really big thing. We want to keep an eye on that because gum disease can actually hurt the diabetes and make your blood sugars even more out of control.
Oh, okay.
So we'll keep an eye there. I think we've caught this at a very great time, an early stage. You have a good prognosis. I think we'll do very well with this. At this time, I don't see any need for any surgery, any extractions, and you really don't have anything to be referred because we're not going to do any of those right now. If we don't do anything at all, though, like I said, the disease will just progress and continue to get worse. So I really want to make sure that you understand how important it is to get it taken care of. I'm going to have 2.5 hours. It'll be just dedicated just to you. It'll be you and I getting things clean. We'll spend a lot of time talking about what you can do to better your gum tissues at home. You will not have any discomfort because I'm going to get you nice and numb, and we'll make sure that we take care of everything and keep you comfortable. Do you have any questions about any of this?
Just how much it might be, that's all.
Okay, we'll go up front. I'm going to talk to them and we'll get your insurance and benefits in there. Today when I come back though, we are just going to clean the top portion of the tooth. So we won't go more than 2-3 millimeters. So those areas with the fours and the infection will still be there. That's why we'll bring you back to get that taken care of. Okay? Great. I'll be back.